Hi, welcome back. This is another MCQ pattern question which is directed at parents. I hope you like this and do subscribe, do share, and do like the video as well, because we want such information to reach more parents and the effort should be justified. In case you have not become a member of the channel, do consider becoming a member. You can click on join in the channel page. So this question is related to toddlers. Which statement is not correct in relation to looking after a toddler? The first point, use of a baby walker is not recommended. Second point is ideally no exposure to screen time till 18 months of age. The third point, start brushing the teeth soon after the teeth erupts. Fourth point is try to give fruit juices frequently. And the last point, encourage water and fiber intake and reduce the milk intake as the infant grows older. So obviously there is only one choice which is not correct, the rest are correct. So please pause your screen for a second, think about the response and then unpause. So I'll discuss the options. Use of a baby walker is not recommended. I've discussed this previously, mainly because the child doesn't gain anything by moving fast before they're ready to move. Often they push on their toes and this may lead to toe walking and unstable gait when they actually are meant to start walking. So you may have delayed walking as a result of using the walker where they sit and push. When the child has a delayed walking, you can use a push type of device, and that's different from the routine baby walker we are discussing here. There is also increased risk of accidents and better to avoid. There is no screen time exposure recommended till 18 months to 2 years, and this is very true, very important, because screen time exposure leads to language delay in many children. Sometimes we often are worried about whether there is an autistic spectrum problem because the child doesn't interact. This three-dimensional interaction with the family is lost when there is more screen time. Tantrums are more common, disciplining becomes a problem. So please avoid screen time from the beginning. If you have older kids who are used to screen time, try to explain to them and move them away from the young kid who is not to be exposed. The third point is very important as well. You can refer the videos by Dr. Sania on my channel on dental care in kids. As soon as the teeth erupts, we recommend brushing with a fine finger brush. You can start using a paste meant for babies under 2 years, which is low in fluoride content. Babies don't need to spit out, and swallowing this low fluoride paste actually gives them some additional fluoride, which is good for developing dentition. The fourth point is the incorrect one. So don't give fruit juices frequently, because fruit juices don't have the benefit that we get from fruits. Fresh fruits give fiber. They have additional vitamins, antioxidants, but the juices have mainly the fructose, which is the sugar, and the water content, which may affect the appetite of the child as well. So avoid giving fresh fruit juices. The juices are acidic and they are not good for the developing teeth, both because of the sugar content and because of their pH. We should encourage water intake right from the time we start weaning, otherwise you may get hard stools. Fiber intake should be built in, so you have to give fruits, vegetables and fiber containing foods as part of the diet. And the milk intake has to reduce as the child starts taking more solids. Milk twice a day of 100 to 200 ml is adequate. If the child is constipated, you can actually reduce it to 100 ml 2 times. If child is passing stools, normally 200 2 times. But if the child resists or refuses, you can easily compensate by giving yogurt and other components. Milk is not essential after 1 year of age. Some children are bloated after milk because they have a partial lactose intolerance, so you can avoid milk in these kids and try to give other substitutes to meet the protein and calcium needs. I hope this helps, and please do subscribe, do consider becoming a member of the channel as well. Thank you.